My name is Dr. Waseem Hussain. I'm a board-certified family medicine doctor who works here at Metropolitan Medical Specialists, an affiliate of Doctors Community Hospital. So cholesterol is a very waxy molecule. It's in the sort of the fat family, and the human body needs cholesterol. Like, it makes about 70 to 80% of the cholesterol in a person's body is made by their body. It's made by the liver. And the cholesterol is a big part of neurologic tissue. It's a big part of the brain. It's a big part of the membranes that make cells up. The problem occurs when there's too much cholesterol in the body. The old model, let me go over that for a second, was this basic idea that the total cholesterol should be less than 200, and then depending on the amount of risk factors that you have, if you have not a lot of risk factors, basically let's say you're 20 years old, you're in great shape, you don't really have any medical problems at all, and you have a cholesterol that's 220. So in that model, like, you would look at that and you would basically say this is a young person who doesn't have any risk factors, and their number should be less than a certain number, specifically a low density lipoprotein or bad cholesterol number under like 160, and so on and so on. So the more risk factors somebody has, the threshold gets lower and lower. So on the other end of the spectrum is somebody who has a lot of issues. They smoke, they have diabetes, they have high blood pressure, they're overweight, they've already had a heart attack, they may have had a stroke. And in folks like that, the recommendation was basically to get the bad cholesterol under 70. But what happened is, what they found is, the science behind a lot of that stuff wasn't really backed up by a lot of sophisticated studies, because those numbers didn't take into account all the different risk factors a person has. So the new model is basically based on assessing somebody's risk. So instead of looking at somebody as this number is too high or this number is too low, what we're really looking at is this person a high-risk person for a heart problem or a stroke? Is this person a low-risk problem for a heart problem or stroke? And then there's a way that we actually calculate that. So what happens is, step one in figuring this out is you get your cholesterol checked. And then what you would do is you take the breakdown of the cholesterol and you go over it with your doctor. And what your doctor will do then is he'll plug in all the different numbers in your cholesterol profile into kind of an equation that takes into account how much good cholesterol you have, how much total cholesterol you have, what are your risk factors, like have you had a stroke, do you have high blood pressure, do you have diabetes, those type of factors. Your ethnicity is a factor in this. A lot of the old studies were just based on white people, so the newer studies kind of cover a larger swath of the American population. So it's a more accurate way to assess somebody if they basically need medicine or they don't need medicine, or if they have a problem or don't have a problem. A lot of it is genetic. Like I said, 70% of the cholesterol in a person's body is made by that person. So even if you literally just ate grass day in and day out, you would still, if you have a genetic proclivity towards having a really high cholesterol, have a high cholesterol. So genetics play a big factor, but I think probably in our society a humongous factor really is how people eat. So diets that are very high in carbs make the cholesterol higher. You don't normally associate carbohydrates with cholesterol, but what happens is if you eat a lot of carbohydrates, and when I say carbohydrates, I mean like white stuff, that's stuff like rice, white bread, white pasta, white potatoes. White potatoes are probably the most toxic of all the carbs and the white things. So even if you're steaming your potatoes or boiling your potatoes and baking them, it's creating a lot of inflammation in your body because of the heavy carbohydrate intake. And then there's a chain reaction from that actually causes high cholesterol. So that's one element, heavy carbohydrate intake. The second element is just a diet that's just too heavy in saturated fat. So this is stuff like way too much butter, way too much red meat, way too much fried food, diet that's heavy in cheese. Shellfish has a lot of cholesterol in it. So when I say shellfish, I mean shrimp, crabs, lobsters. Even if they're not fried, they have a tremendous amount of cholesterol in them. And to some degree, eggs have a lot of cholesterol, though our thinking about eggs has been changing. A healthy person can still eat a good amount of eggs, and it's not going to screw up your cholesterol that much. So the dietary factors are critical. The carbohydrate intake elements are essential. And then there really is an element of exercise associated with this as well. So again, if you're just sitting most of the day and you're not that physically active, that slows your metabolism down and it creates a dysfunctional metabolism that feeds the system to cause it to have a higher cholesterol. So this too falls into the category, I would say, of the silent killer type of thing. Most people have no clue they have high cholesterol because there's no physical manifestations of that. Very, very rarely in certain cholesterol syndromes where the cholesterol is extremely high, like you'll see subtle signs on a physical exam, like you'll see people have these weird, like white pimples like scattered. They're like these yellow fatty pimples all over their body. But outside of that, which I rarely see in anybody because most people don't have cholesterols that are that out of control, it's completely silent and you can't tell. You can't tell until basically it's too late, until after you've had a heart attack or you've had a stroke or those type of problems. So the only way to really detect it is to get regular surveillance, seeing your doctor, getting a blood test done. That's basically the key to making that happen. It's a really common problem. About 1 out of 3 Americans have high cholesterol, and only about half of those folks even know they have it. And of those folks who have it and who know who have it, only 1/3 of those folks are actually on medicine and have it treated to the right level. So a lot of the cholesterol is in our country totally not even identified and not even treated the majority of the time. There is a sort of distribution in terms of who you see higher cholesterol in. In terms of ethnic groups, across the board, it's pretty much 1 out of 3 people have high cholesterol. But Mexican American men have probably the highest rate of high cholesterol in guys, and African American women have the highest rate in women across the country. So definitely, you know, if I have a new patient and they are Mexican American and they're a guy, or they're African American and a female, you know, my radar is going to be up for basically looking for high cholesterol issues in that population. So we always want to start off with lifestyle changes. And so that goes back to what we talked a little bit about before about decreasing carbohydrate intake and basically sticking to the principles of that Mediterranean diet that we talked about, which is whole grains, lots of berries, really healthy nuts like walnuts and pecans and pistachios, using olive oil in your cooking, salmon or herring or tuna 2 times a week. That's going to basically be the foundation of it. There are certain foods that are known to actually lower cholesterol, and one family of foods that really helps is actually apples. So that old saying about the apple a day keeps the doctor away, that's completely applicable to this situation, and there really is good evidence that apples will lower cholesterol if you eat 1 a day. Strawberries are in that group as well, grapes are in that group as well, and then there's actually a lot of evidence that citrus, if you eat a lot of oranges, that can actually lower the cholesterol as well. There are some other subtle things. Pomegranates can help. Drinking green tea, there's some value to that as well. That can actually lower the cholesterol as well. And then there's a lot of value to eggplants and okra. Like if you eat a lot of eggplant and okra, that will also naturally bring the cholesterol down. All of those things have a common denominator. They have this stuff called, many of them have these things called, like there's a natural occurring chemical in these healthy fruits and vegetables called plant sterols, and that's basically how the cholesterol comes down. Some people buy supplements. If you go over the counter and you buy a supplement that can certainly help bring the cholesterol number down is this thing called red yeast rice. That is basically a concentrated version of this stuff that's found in a lot of the vegetables, and that's over the counter and relatively easy to take. So that's kind of the diet and supplement part of the conversation. Like I said, reducing carbohydrate intake will have an indirect effect on the cholesterol and really help the profile tremendously. And you want to treat the other problems that often run with cholesterol, because most people who have high cholesterol, they don't just have high cholesterol. They also have high blood pressure. They also have diabetes. And so you need to address those 2 other issues to help as well. And no doubt about it, weight's a major factor in this story as well. And all of these things that we've been talking about, high carb diets, sedentary lifestyle, poor sleep quality, that increases weight and subsequently leads to a lot of bad eating behaviors, the way your body metabolizes food gets messed up, and then that causes high cholesterol. So addressing that is part of treating the high cholesterol issue. And then once we address all of those issues, the other big thing is medicine. So there we have a class of medications called statins. Statins are cholesterol medications that have been around for almost 30 years now, and that's basically the gold standard in how we are able to bring the cholesterol numbers down. And treating the cholesterol and bringing the numbers down, that definitely helps dramatically. If you aggressively treat somebody's cholesterol through lifestyle modification and through cholesterol medication, I also forgot to mention stuff like fish oil and flaxseed. That's another great way to bring the numbers down overall. You can basically reduce somebody's heart attack risk by about 30 to 40% by doing those things. Cholesterol, when it's moving through the bloodstream, it doesn't just like float there by itself. It's sort of like, have you ever seen one of those Ferrero Rocher chocolate things? They're like a shell of chocolate and then inside is the good stuff and you eat that. That's sort of what cholesterol, that's how it like lives in the body. It like lives in this protein shell, and that's how it's carried from point A to point B in the body. And so depending on what type of protein shell is carrying the cholesterol, that's how we determine good cholesterol and bad cholesterol. So the protein shell, the technical name for it, it's called lipoprotein. And so LDL, or bad cholesterol, that's the type of cholesterol that you don't want to have too much of, that lives inside of this thing called low density lipoprotein. And that's what LDL is. And then HDL, which stands for high density lipoprotein, that lives inside this protein shell of high density lipoproteins. And the more you have of the high density lipoproteins, the cleaner your blood vessels are. And so in a perfect situation, you want somebody who has a really high HDL, that's good cholesterol, and a really low bad cholesterol, that's LDL. And then another factor that's not directly connected to cholesterol, but is an indicator of the overall way that they metabolize fat in their body, is something called triglycerides. Triglycerides are a different molecule, but it's more of a reflection of exactly how much like fat is in your body and how well you metabolize things. So if you eat a lot of cheese and you eat a lot of fried food and you eat a lot of red meat, you're not only going to have a screwed up bad cholesterol, but you have a lot of this stuff called triglycerides. And in a lot of folks, the higher the triglycerides get, the lower the good cholesterol get, and that magnifies the cardiovascular risk of having a heart attack or a stroke. So that's what HDL and LDL is, and it's an important distinction, because a lot of times people will come in and they'll say, you know, my cholesterol is over 200, but when you look at their profile, they will have a high total cholesterol, but a lot of their total cholesterol is good cholesterol, so that's good. So that's why the breakdown of the different lipoproteins that's going to be the way to really evaluate somebody's overall cardiac risk. And so with these lipoproteins, when we're giving somebody medicine for it, like we know we're giving them the right medicine and we're getting the result when we're able to drop their sort of previous cholesterol level. You were asking about numbers before. Like if we can just get their numbers down from like where they were down to 30, 40, 50% lower than where they were, that's the goal. Like it's not so much looking for what number we're trying to get to, we're trying to get a certain percentage of that number down, because that's what's been shown to basically decrease the heart attack and stroke risk. The natural sort of bad cholesterol level is usually 50 to 60, or usually less than that in many people. It's a chain reaction of bad things that happen. So basically what happens is, if you have too much cholesterol in your blood, it basically screws up the plumbing. Like the walls of the arteries, they start to develop this stuff called plaque. So plaque is basically gunk and junk that is rusting up and turning into a bigger and bigger mound on the inside of the blood vessels. And as that gets bigger and bigger, then it starts to obstruct the natural flow of blood. And if it gets obstructed enough, you basically end up with a stroke or a heart attack or kidney failure. Those are basically the biggest problems that occur with it. What happens is that when that plaque gets built up like that, eventually the top of the plaque gets torn off and then blood clots to the top of that, and that's how you get a blood clot and you block things off and you have a heart attack or a stroke. So the cholesterol, if you can control the amount of cholesterol in the blood, then you don't get the plaque buildup. So that's the whole point of basically treating cholesterol, to avoid that from happening. So having some of these other diseases actually stimulate the production of higher bad cholesterol. One of the biggest problems is chronic kidney disease. So as the kidneys are getting beat up by age, beat up by high blood pressure, beat up by taking too much Advil and Motrin and ibuprofen and alcohol, like as the kidney function decreases with age, and especially if that's accelerated, then the cholesterol starts to go up as the kidney function starts to go down. So when we're having conversations about cholesterol, it's important to look at all the organs, like not just the heart and not just the cholesterol, but getting the kidneys checked out as well. Another big organ that's a factor in cholesterol metabolism is your thyroid. So low thyroid is a very common problem, and if the thyroid gets too low, that starts screwing up the cholesterol profile as well, and you'll start to see rises in bad cholesterol and decreases in good cholesterol if the thyroid's not well controlled. So kidney disease and thyroid disease, but the biggest one of all is going to be diabetes. So diabetes basically creates this sort of like really screwed up metabolism in the body, so the body cannot handle the cholesterol as well. So diabetes is very strongly associated with messed up cholesterols. So we want to be on the lookout for that as well. When we catch somebody with high cholesterol, we want to also ask the question, how's your blood sugar, how's your thyroid, how's your kidney function? There are ways that we can tell how much, how aggressive we need to be about managing somebody's cholesterol. And the way we can tell, besides using these sort of risk factor equations that I was talking about before, is there are some other tests that can be done on a blood test. One blood test that you may want to ask your doctor to check is something called high sensitivity C-reactive protein test. Your doctor would know about this. And basically, when we're making decisions about if we're going to put somebody on cholesterol medicine or not, that's a valuable variable to look at. This number called CRP, or cardiac CRP, it basically tells us indirectly how much inflammation and stickiness is in your blood vessels. So if you have like a really high number on this, then that means you're at a higher risk for heart disease, and we should be more aggressive with managing your cholesterol and maybe not just treat you with diet and exercise. There's another great modality that we've started to use to help stratify people into who should be treated and who should not be treated. It's called coronary calcium scoring, and a lot of the places around here offer that. It's basically a low expense way to basically actually get a look at the heart. Basically, it's a CAT scan that looks at calcium buildup in the blood vessels of the heart. Remember when we were talking about plaque? Like the plaque, the stuff that blocks up the blood vessels? Well, a big part of that blockage, the big part of the stuff that blocks up blood vessels, that plaque, is not just cholesterol, but it's actually calcium deposits. So you can detect those calcium deposits on a CAT scan. And if you have a lot of that, well, that may change the way your doctor looks at you, and you would be somebody that we would want to be more aggressive about treating with cholesterol. So those are some of the other ways that we make a decision about who should be on medicines, who should not be on medicines. Can we manage this with just lifestyle alone? So the hospital has a variety of different health fairs, and then we've alluded to the van. The van also does health screenings. So at these screenings, very frequently, they'll do these sort of like right on the spot blood tests that tell you sort of what at least what your total cholesterol is. And some of the testing can actually show you the breakdown of good cholesterol and bad cholesterol.